Welcome to Broward Health's virtual chat series, Your Health, Our Priority. This edition, we are focusing on HPV vaccination awareness. And joining me is Dr. Ryan Sobel, a head and neck oncologic surgeon at Broward Health. Welcome, Dr. Sobel.
Thank you. Thank you for having me.
Oh, you're welcome. Thank you for being here. We have such an important topic to discuss today. And I want to just officially introduce you to our audience by reading your bio real briefly. Dr. Ryan Sobel, a head and neck oncologic surgeon, joined Broward Health Physician Group with his new primary practice location at Broward Health Medical Center in Fort Lauderdale. Sobel has extensive experience in transoral robotic surgery. Prior to joining Broward Health, Sobel worked at Johns Hopkins Head and Neck Surgery at the Milton J. Dancer Jr. Head and Neck Center, Greater Baltimore Medical Center in Baltimore, Maryland. He also served as the Director of Head and Neck Surgical Oncology at Inox Fairfax Hospital. Sobel earned his medical degree from Drexel University College of Medicine and completed his fellowship at Johns Hopkins Hospital for advanced training in head and neck oncologic surgery. So welcome again. Today we have such an important topic, the HPV vaccination. So let's dive into it. What exactly is HPV and what is the vaccine about?
So the HPV, or human papillomavirus, is a group of about 200 typically contracted through sexual contact. It can cause a clinical infection in patients, or in some cases, it can cause very harmful cancers in the oropharynx, which is the back of the throat, or in the genital area. These are typically caused by more high-risk strains of the virus. The vaccination is important to prevent any clinical infection or involvement of the patient's tissues by the virus, so it's a preventative measure.
Okay, and why is it important? Is it a deadly virus? I mean, most viruses, I'm sure, has some deadly consequence to it at some point, but why is this so important?
Well, there's been extensive research done into how the human papillomavirus is spread, and it's been found that up to 80 to 90% of patients in the United States can actually contract this virus. Not everyone gets a clinical infection, and not everyone gets a cancer, but there's no way of determining which patients will get what. So it's extremely important to prevent any harmful accounts of this, which would be specifically the cancers that's caused by the virus.
And what type of cancers, because we know that there are like many types of cancers, and cancers are, I know you mentioned oral, so what type of cancers does the HPV cause?
So high-risk strains of the human papillomavirus can cause cancers in the cervix, vagina, the penis, the anus, and more specifically now we're seeing in the head and neck area, specifically the back of the throat.
Oh, wow. Okay. So that's interesting, that the head and neck and back of throat. Like, can you dive a little bit more into that process, especially that's your specialty area? Like, what do you often see, and how fatal is it?
So when we talk about HPV-related cancers in the throat, really we should back up and talk about head and neck cancers in general. So traditionally, when patients think of these types of cancers, they think of patients who smoke or who use a lot of alcohol. But we're seeing there's a rise in cases of patients who have no smoking history whatsoever and who do not drink a lot of alcohol. So these are your sort of everyday patients that don't have any other major medical problems. And these patients are getting cancers in the back of the throat, specifically involving the tonsils and the coating of the back of the tongue. We call it the base of tongue. Now, what we're seeing in research is that this type of cancer behaves much different from the type of throat cancers that we see from smoking. So it's a completely different disease entity and has a completely different prognosis associated with it. We're seeing that these patients have very treatable disease. It may require a combination of surgery, radiation, and chemotherapy. So it's certainly not without its risks and requires extensive efforts to treat it. But we're seeing that the prognosis is a little bit improved in comparison to the traditional head and neck cancers caused by smoking. That being said, it's completely preventable. Just like lung cancer may be preventable by not smoking, or skin cancers may be preventable by wearing sunblock and avoiding, the sun at high risk times of the day. This is something that is completely preventable.
And what are some of the preventative measures that can be taken? Is it only the vaccine, or are there any other?
Well, the research that's been going on has shown that the vaccine is extremely effective in preventing the HPV virus from being contracted. So if you don't have the virus in your system, then you won't develop the cancer.
Okay. And then how young and how old can you get the vaccine?
So there's a strategy involved with when we give the vaccine and to whom we give it. Ideally, this is given to both boys and girls between the ages of 9 and 12. That's always cited as the most effective time to give the vaccine, because what we're trying to do is preempt contracting the virus. So we're trying to reach kids before they become exposed to it. There's no evidence that there's any downstream risk in increased sexual activity by doing this. It's a very safe vaccine to give that's given in 2 doses. The effectiveness of the vaccine goes down the older the patient is. We still recommend getting the vaccine really regardless of how old you are, up to usually the age of 45. However, as you start to get older past your teenage and young adult years, you're likely going to be exposed to at least some of the strains of the virus, and it's really difficult to determine how effective it's going to be in the future because we're not sure which viruses the patient has been exposed to. So to get the most benefit from it and to have it become the most effective form of preventative measures, we recommend getting it to young kids.
Okay. And are you seeing any objections from parents with getting this particular vaccination? And if so, how are you able to encourage them or change their perceptions?
A lot of it has to do with education. There are very specific guidelines that have been sent out to primary care physicians about the importance of the virus and the importance of the vaccine in preventing the virus. And most are on board. It's not on the official mandatory vaccination schedule that most kids have. It's not an optional one per se, but it's something that in many cases parents have to ask for more information about, or pediatricians have to, or family practitioners have to specifically offer. So education becomes extremely important on the part of both the parents and the primary practitioners to make sure that we can protect as many patients as possible.
That definitely makes a lot of sense. And from a safety standpoint, if you had to rate the vaccine safety, how safe is it?
Well, the vaccines that are available currently have been available for over 10 years. There's been significant research that was done prior to giving the vaccine initially in those first patients, and there's been extensive research done since then. The vaccines have been proven very safe. The most common things that patients notice is redness or soreness around the injection site, sometimes a fever. These are things that are common with essentially every type of injectable vaccine that any patient would get. So there's no undue risk or any major risk that we're seeing.
Okay. And are there any symptoms for HPV?
So that's the interesting part of this whole thing. For head and neck cancers, we're seeing a huge rise in this. Typically, it involves men. And a lot of times when I see men in the office with HPV-related throat cancers, they have no knowledge of ever having contracted this virus. And that seems to be more common than the alternative, where patients have a known history of contracting the HPV virus. The reason for this is because the area in the head and neck that's involved by a clinical infection when you contract the HPV virus is that it's in the back of the throat, where the tonsils are in the back of the tongue, that people just don't normally look back there. And there's, in many cases, no symptoms associated with contracting the virus. It's just sitting in the tonsil tissue in the back of the throat, dormant, until at some point, 15 to 30 or so years later, amounts as a cancer.
Wow. Now, I know for women, there are screenings that can be done, such as pap smears. Are there any type of screenings for men prior to the cancer manifesting? Or
yeah, so the screenings, including pap smears, for example, have really helped with the incidence and early diagnosis of cervical cancer. Unfortunately, there's no approved screening methods for screening for HPV-related throat cancers. The most common symptom that patients will notice is an isolated mass in the upper portion of the neck, typically around where the jawbone is. It's a large mass that feels firm and just doesn't go away. So it's important that any mass that any adults feel, men or women, in the neck that persists for more than 2 weeks get evaluated by at least the primary care physician and ideally by a head and neck surgeon.
wow, this is such great information. Are there any other tips or information that you can provide for our listeners?
Well, the most important thing is, if you're a parent, a grandparent, aunt or uncle, the best way to prevent this cancer at this point is to make sure that all the kids in your family are thoroughly vaccinated. And it's important that if your primary care or family practitioner doesn't talk about the HPV vaccine, that's a great time to bring it up yourselves and have any questions addressed that you may have. It's an important thing that really doesn't have any extra risk, and downstream can potentially save your child's life.
Absolutely. And how does one reach you if they have questions, if they want to get their child vaccinated? How do they get in contact with you at Broward Health, Dr. Sobel?
We can offer our contact information. I'd be happy to see any patients in the office. The important thing to keep in mind is that for adult patients, if you notice a neck mass that doesn't go away, or any changes in your swallowing, or if you've seen a doctor before and have been diagnosed with a head and neck cancer, please see a head and neck cancer specialist as soon as possible so you can get treated.
Absolutely. Well, thank you so much for joining us today, Dr. Sobel, as we educate our community about HPV and vaccination awareness. And thank you, everyone, for tuning in. This is Broward Health Virtual Chat Series, Your Health, Our Priority.
For more than 80 years, Broward Health has provided compassionate care to our community, growing to be one of the 10 largest public health systems in the United States, with convenient locations throughout Broward County. Broward Health has urgent care centers for minor health concerns, primary care providers and specialists across multiple disciplines, outpatient centers for quick access to diagnostic services and treatments, the Sala Foundation Children's Hospital for advanced family-centered pediatric care, and acute care hospitals with dedicated trauma centers. Broward Health seamlessly provides a complete continuum of care at every point of your healthcare journey. Our services cover the entire health spectrum, including bariatrics, cancer services, emergency services, heart care, neonatal care, neurology, orthopedics, pediatrics, senior care, transplant, and women's and maternity services. As the first provider of open-heart surgery in Broward County, Broward Health continues our tradition of innovation through advanced, minimally invasive robotic surgery and investments in clinical research and academic medicine programs. Our outreach programs, such as preventative health screenings and wellness education, can help prevent chronic diseases, promote healthy lifestyles, and improve the health outcomes of everyone in our community. Broward Health, where award-winning care and clinical excellence are all close to home. Broward Health, a passion for caring.